Hello everyone. I'm Dr. Anil Kamath. I'm a surgical oncologist here at Healius Cancer Clinic. So, one important aspect of cancer treatment is pain relief. Many cancers, whether sometimes in the early stage or more often in the later stages, can cause severe pain to the patients. The pain can be due to various reasons, but mainly it is because of the cancer growing into the nearby tissue and infiltrating the nearby nerves and other structures, which leads to pain. Though treatment itself may bring down the pain, in certain situations this does not happen and the pain continues. And in certain other condition, the cancer would have progressed to a stage where there is no treatment and the patient will be suffering from severe pain. Now, as doctors, we have seen the consequences of pain. Pain makes the patients hostile. They feel that the others near them are unable to understand their situation or are not doing enough to relieve their symptoms. The lack of sleep can also lead to other problems because of pain, and the pain affects the other family members also, because when the patient is shouting with pain, it affects other people in the family. So, how do we control pain? Now, apart from the treatment itself, let me tell you broadly how we approach pain. First of all, a proper history about the pain is important. We have to make an attempt, as clinicians, we have to make an attempt to see how severe the pain is, how much it is affecting him, what type of pain it is. All pains are not the same. Certain pain, one pain can be different from the other, and also make an assessment of the psychological status of the patient. In terms of treatment, we follow what WHO has prescribed as a step ladder approach. Normally, we start with simple analgesics, which are easily available over the counter. This may be paracetamol or aspirin or acetaminophen. This is initially given on a SOS or as required basis. So the patient has pain, he takes one tablet. But for many patients, this is not enough because the pain is more constant. So the next step, as per the step ladder approach, would be to give these painkillers on a regular basis. So they may need painkillers, say 3 times a day or 4 times a day. So we plan it like that. Of course, while giving these painkillers, we have to keep the other conditions of the patient in mind, like they have some kidney problem, then NSAIDs may have to be avoided, and so on. The next and important steps, we frequently get patients in whom these regular painkillers are not working. In those patients, we tend to use opioids. There are two types of opioids. One are synthetic opioids like tramadol, which are more easily available. And for the patients who have most severe pain, as a last approach, we tend to use morphine or patches. Morphine is a very important drug for pain control. It is a very cheap drug. Unfortunately, it's not available easily in the pharmacy. It is available only with the doctor's prescription. But many times it gives a lot of relief to the patient. It can be started at a certain dose and we can keep going up on the dose as required. And I have seen in my own experience that morphine gives patients very good relief. They wouldn't have slept for many days, and with morphine, they would be able to sleep. Many patients are worried that morphine leads to addiction, but this is not correct. When used in a correct manner, the chances of addiction with morphine are very small. The side effects of morphine, the most important side effect that we come across is constipation. This can be managed with laxatives, but sometimes it tends to be very severe. Other side effects of morphine can be easily managed. For those patients in whom getting morphine is difficult, we have the next option, what we call patches. We have different patches like fentanyl patches. And these are equivalent to morphine and can be stuck to any part of the body, and it works for 24 to 48 hours or sometimes even more. So that is the approach we take. And as oncologists, our suggestion is, after making an assessment, if they need opioid analgesics, if the pain is very severe, that opioid analgesics are required, if morphine is required or patches are required, then patients should not be denied that. Because most of the time, the benefit of these drugs are much more than the side effects. Of course, certain types of pain may not respond to even morphine or fentanyl patches, especially certain types of neuropathic pain. These patients sometimes we refer for interventional procedures like nerve blocks and other this thing. Now, another important aspect of pain is the psychological aspect. And sometimes just giving pain relief is not enough. We may have to add antidepressants also along with that. And sometimes we even tend to use mild sedatives so that the patient can have a peaceful sleep. So these are the various steps that we take for relief of pain in cancer patients. So if you have a patient who is a cancer patient who is suffering from severe pain, please meet the appropriate specialist and see that at least a good pain relief, which is a basic need for most patients, is taken care of. Thank you.